Hello everybody, thank you very much. My name is Etienne. I'm an activist in ED for 12 years. I'm not a PrEP user, but I'm HIV positive. And for the little story, I was infected in the hyper-gay trial because I was in the placebo arms, but it's not, there is no issue, I'm okay. I take one pill a day, I'm undetectable, and all is okay for me. But, thank you. But I'm just even more determined to make PrEP accessible to people who want it. And by chance, it's my job. I work for PrEP for 4 years, and my work is to coordinate the actions of the organization aiming at the better implementation of PrEP in France. So let me start. The big button. Okay. Let me start my presentation with figures, the results of our action. The last figures official we have are from last year. You can see there with 10,400 people start PrEP in June 2018. And one of the only thing we have about them is that there are 97.7% of them are men. So we also knew the number of new PrEP users. You see each lines are the new PrEP users each month. And with this, we can do an estimate of how many PrEP users there is today. And we can approximately estimate that there is 1,800 people in PrEP in France. But it's only an estimate. We will have official figures next month. This is just about PrEP. Until then, like Timur told us yesterday, we had not yet observed the decline of HIV in France, but it was before, because just recently, 2 days ago, we had the great news that I'm very happy to present you. In Paris, we have 16% of decrease of new HIV cases, sorry. There is the details. There is a decrease of 22% among MSN, 28% among MSN born in France. And we have official figures of France, 7% of new HIV cases of decrease. So it's very, very good news for us. It's the first time. It's the first time, and it's a significant decrease. Be careful, as for Sydney, San Francisco, or London, this good result can be attributed to PrEP, but also to TASP, of course. So, as you know, PrEP has been authorized and fully reimbursed since 2016. We are aware that we are very lucky compared to others because we were the first European country to have this. But what I'm going to show you now is that if we stop to fight at this time, we would never have obtained the good figures I just presented to you. So let's go back 4 years ago when PrEP was authorized in France at the very beginning of 2016. Having the authorization and reimbursement was not enough to make PrEP a success. At this time, indeed, PrEP was only accessible at the hospital, so we had to improve its access. Just a few people knew about PrEP at this time, so we had to promote it. And just those who took it already, those who took PrEP informally, were totally alone. So we had to support our peers who took PrEP. My work And our action as an NGO for 4 years was mainly on these 3 points. In each of them, I will try to show you concrete examples of actions and initiatives that have worked. And as Will said yesterday, do not hesitate to replicate, to collaborate with us. As I told you before, PrEP was only available at hospital in HIV services in France at the beginning, but nobody knew exactly in which hospital you can find it. So one of the first things we did was to reference PrEP consultation on a map, and this map progressively became the official map in France, and it has become a real public service. But obviously, it was not enough, because some hospitals didn't want to prescribe PrEP. So we had to do a local advocacy work to fight region by region, city by city, and to make sure all the hospitals started doing PrEP. Now it's almost the case, but we fought a lot for it for 4 years. At the first, the fact that PrEP was prescribed only in hospitals was a guarantee of compliance with the guidelines across the country. And this was probably one of the elements that reassured the authorities and led them to authorize PrEP in France. But, as you've seen with Daniel, the fact that PrEP was only available in some cities and hospitals has become a barrier for many people. That's why we are developing innovating projects such as ePrEP in Centre Val de Loire, but it's also what pushed us to start a strong advocacy work to change the law. So that's how the authorization to prescribe PrEP has been extended to the screening centers, the HIV screening centers in 2017. The prescription was extended for minors in 2018. And finally, Minister just confirmed us 2 days ago that the general practitioners will be able to prescribe PrEP in the coming months. So it's a really good news too. In the same way, PrEP was authorized in France in 2016 with a very, very strong medical follow-up. For example, someone who wants to take PrEP today in France must see a doctor 3 times in 1 month. One before to do the test, once to have the prescription of the PrEP, and once 1 month after the prescription to check that there is no bad things, there is no problem. Then you have to see the doctor every 3 months. So it's great. It's a high-quality monitoring. We search and treat a lot of STIs. We minimize risk of complications. And just like PrEP in hospitals before, that is probably one of the elements that reassured the authorities and led them to authorize PrEP. But it has become a barrier for a lot of people because it's much too heavy for some people. So we are currently working now to simplify this follow-up in order to bring more people to PrEP, especially younger generations. PrEP has to be easy now. But simplify does not mean give up quality. For example, we observed several delivery mistakes by pharmacists in some regions in France. They gave tenofovir only, instead of giving the combination tenofovir and emtricitabine. Of course, we alerted the health authorities and we started to write a pharma PrEP guide with the pharmacist professionals of the sector. And then our activists distributed it in many drugstores in France. Qu'est-ce que j'ai fait de mes papiers? As I said to you, PrEP was nobody knew about PrEP in 2016, so we had to promote it. It was necessary to create the first guide about PrEP for the public. This particular guide, for example, has become the reference guide in France. Today, most doctors give it to PrEP users in their first consultation. We translated into English and for non-French speaker, and I think you saw them at the entrance of the room. We also develop this range of diversified prevention, who, of course, include PrEP. We develop videos, but I won't show you them now. But we can obviously share them with you if you ask for them. Then we produced this first public promotion campaign about PrEP in France. As Will said yesterday, we asked to Chicago HIV organization the permission to duplicate their PrEP for Love campaign. Indeed, we found the concept very interesting, very beautiful, and thanks to donations of advertising spaces, we were able to broadcast this campaign into the metro and on the bus stops. We are proud about this. Now we urge the authorities who have much more money than us and the legitimacy of public health to make their own campaign to promote PrEP. And we wait for it. We still wait for it. This communication work is not enough. There is nothing better than promoting PrEP inside communities. This is why we work on projects like Revolution with MSM in Caribbean community. I learned that Ellie has presented to you yesterday. It's also the goal of outreach actions like the ladies' actions that Jennifer presented to you yesterday too. This is obviously not enough, we know, because we have 97.7% of men in PrEP in France, but we will be inspired by your experiences to do better and to help communities themselves to increase use of PrEP inside them. In particular, women, sex workers, young MSM, MSM Afro, MSM Latino, and etc. But unlike the English-speaking countries, in France, unfortunately, the concept of communities is badly seen. So we do with that, but it's considered contrary to the universal values of the Republic. In France, we are almost the only organization to defend the community-based approach. So this brings me naturally to my last part. Support our peers to take PrEP. In 2016, it was just informally PrEP use, and they were really alone. So one of the first things we did is to create this group with Vincent, who is here, a Facebook group inspired by PrEP facts in America. And as our poster on the subject shows, it's a unique space of self-support in sexual health for nearly 11,000 people, including a majority of PrEP users, but also HIV-positive people, health professionals, activists, etc. Thank you to our activists like Thibaut, who is here today, who contribute every day to this group to make it a success. This topic are numerous, but I think you know this type of group because now there is a lot. Every country has developed these groups, and it's a good thing. And to finish, it's not just virtual support. A big part of the activity of Ed about PrEP for these last 4 years has been to support the new PrEP users in hospital services. The model that we follow was peer workers of Hypergay trial conducted by Stefan, who told us about PrEP regimens this morning. These peer workers played a vital role in bringing in patients in consultation by Grindr, for example, or Hornet. They also played a facilitating role in helping doctors to understand MSM practices, MSM sexuality, chemsex, and so on. And peer workers also help PrEP users to talk about these topics to their doctors. Today, the peer support must evolve. It must also simplify itself, but it will have brought a big dose of community approach in the French medical world. In large cities, the model we are promoting to provide PrEP access to the most exposed population is the community sexual health center. This is the model we decided to create in Marseille, but also in Paris, Nice, and Montpellier, and that Sarah will now introduce to you. Thank you.
Five minutes? Okay. Maybe I'm going to be a little bit late. Hello, I'm Sarah Lablotiere. I'm in charge of Aide branch in Marseille, south of France, and I'm the coordinator of the Spot Longchamp. Okay. The Spot Longchamp is a community-based sexual health clinic located in Marseille, opened since June 2016. It's a space mainly intended for the most HIV and STI exposed people, driven by a friendly and multidisciplinary team that you can see on the picture, who came from various backgrounds but shares mutual attitude. We are peer mediators, doctors, nurses, psychologists and sexologists, social worker, addiction specialist, volunteer and coordinator, me. To reach gay public, we develop specific communication strategy. We have outreach intervention, LGBT places, and migrant support organization. We also have profile on dating website and social network, and we talk to people to promote the spot. We have a wide range of medical social services. We propose HIV and STIs and hepatitis testing. We propose PrEP, PEP, vaccination against hepatitis A, B, papillomavirus, psychology and sexology consultation, social work, and we also develop specific offers for specific needs to the people. No, okay. There are two main different things between the Spot and the other health clinic, sexual health clinic in France. The first one is that the community-based approach is the heart of our project, and the second one is that we provide a global health services. The community-based individual support is really the central component of Spot PrEP pathway. Peer mediators are on the front line to welcome all those who come to the Spot. They receive all people, they provide counseling interview in which they promote PrEP to everyone. As a result, the majority of PrEP users at Spot have at first time coming for a test and choose to take PrEP after the interview with the counselors. The organization of PrEP is adapted to people's needs. We have specific opening hours in evening, at lunch, and the weekend. We have the possibility to take online appointments and reminder for all the PrEP appointments. The second reason for community-based approach is the empowerment of people in their relationships with care providers. They are strengthened in their capacities to speak freely about their health needs to care providers, and also care providers are empowered to have a sex-positive approach of, and to provide adapted pathway to people's needs, like fast PrEP initiation, maybe in 2 or 3 days, or later follow-up adjusted to practices. The community-based support improves also the community mobilization. Today we have about 20 PrEP users who become aid activists at the Spot, and more of them become PrEP promoters in their communities. And the last essential result of peer mediation is to provide the expression of people's health needs and global health response built with them. Yeah, I've put photos in all the slides, sorry. The Spot's wide range permits an adapted and integrated response to the health needs of PrEP users. Since we have opened, 420 people started to take PrEP at the Spot and are followed up for it. We have 332 cis MSM born in France, 56 cis migrant MSM, 24 trans people, and 12 cis women. The global health benefits for all the people on PrEP at the Spot are a regular medical follow-up. Each people come in average 6 times a year at the Spot, and we have very few loss of care, less than 5% of the patient base. We have a vaccine catch-up and referral to sexologists to help improve quality sex of life. But we also identify other global needs. The first one is to set up an offer permitting a faster PrEP initiation. We want to propose fast screening with point-of-care techniques which give results of HIV viral load in 90 minutes. So people may have their PrEP prescription after their negative result 2 hours after their arrival at the spot. The second one is to develop digital services. We are finishing the Spot Longchamp website. The Spot will propose several digital tools like a hotline, a reminder for vaccine appointment or PrEP appointment, and the most important is the anonymous notification partner tool, which people can use it to notify their STI to the partner, anonymous way. So the Spot public on PrEP are various. We have to deal with different issues and propose specific pathway if you want a better implementation of PrEP for the most vulnerable one. I'm now talking of some example of the different spots PrEP pathway. The first one is for the cis MSM are born in France. They represent 85% of the MSM follow-up at the spot. This is the higher transformation rate between a test request and the choose to use PrEP at the spot. The specific health needs for these people is about chemsex. We have 48% of the PrEP user who use chemsex, and we are 82% of chemsex user who taking PrEP. So we set up different services. We have individual community-based support. We have harm reduction materials. We have drug tests. We have a specialized addiction consultation. And we have a monthly self-support group, which name is Before Chemsex. Our main issue for this public is to develop referral partnership and find friendly and family doctor where we can refer people, because they are a risk today of saturation of the spot because there are too many people, so we have to find some new allies in family doctors. For the other people on PrEP at the spot, the implementation is an issue. Okay. HIV promotion are often not their priority need, so we propose other pathways to respond to their priority needs. The first one, The first one is for trans people. One of the trans people priority health needs is about transgender services. We set up specialized consultation in hormonal therapy, psychology, and gynecology. The spot social worker help them in administrative procedure like civil state change, social security rights, and we also have strong partnership with 2 local community-led trans organizations. Since we propose these specific services, more and more trans people start to use PrEP. There are now 42% of the spot trans people who use PrEP, 75% of AMAB people, and 31% of ABFAB people are on PrEP at the spot now. Last example is the cis migrant MSM and sex worker PrEP pathway. The most of them arrive in France in less than 3 years and come from Africa, Sub-Saharan and Maghreb. They are for sure the people with the widest health needs and those who access and stand to PrEP with the most difficulty. Now 18% of the spot migrant people are on PrEP. There were 7% 2 years ago. And we have 10 cis women migrant sex workers who are followed for PrEP at the spot. To improve their access and implement, we provide transition services, social work, support for asylum procedure, psychological trauma care, gynecology, and reproductive health consultation. We also recently chose to put priority on self-support capacity building within the community with 2 different groups. The first one is the Migrant LGBT Collective, and the second one is, I don't know how to say it in World Time, maybe you could put in French. So. And every month, it happens every month. Provide spaces where immigrants, LGBT, and sex workers can speak freely between peers to be a central need. Since we started a few months ago, around 20 people come to this group. PrEP is systematically a topic of discussion in it. To improve the access to PrEP for migrant people, we need a greater engagement with migrant organizations to promote PrEP. To conclude, PrEP is definitely a great opportunity to provide people a better and global sexual health. community-based health clinic cease to be particularly adapted for reaching and engaging the most vulnerable population. We need to simplify PrEP pathway for people the closest to care. In city, fast initiation, online consultation are to develop. Demedicalize the follow-up in spaces driven by multidisciplinary and community-based team is to discuss too. We have to improve the access of the most exposed to HIV people, like cis MSM, sex worker, women migrants, and trans people. But I think it will only work with a global and integrate health response on the strong But I think it only works with the global and integrated health response on the strong and efficient individual and collective peer support. Thank you.